Good afternoon, everyone, and thank you so much for joining us today for the virtual webinar titled What You Need to Know, COVID-19 Vaccines and Children. My name is Dina Pimenova. I am the project coordinator for the NYU Langone Community Health Worker Research and Resource Center, housed in the Department of Population Health at NYU School of Medicine and supported by the NYU Langone Community Service Plan. Today's event is hosted in partnership with the NYU Community Engagement Alliance Initiative, NYU CUNY Prevention Research Center, and the NYU H&H Clinical and Translational Science Institute. Next slide, please. Before I introduce our speaker, I would like to briefly go over some housekeeping. Everyone is on mute. The chat box is open for comments and sharing of resources. We ask that you please use the Q&A box to submit questions to the speaker, and we will have time to answer as many questions as we can during the Q&A portion. The slides and the recording will be made available. I will email those out as soon as possible, and please be sure to fill out the poll at the end. Next slide, please. So today's webinar is geared primarily towards community health workers and frontline staff working directly with community members. We will have a presentation about the safety and efficacy of COVID-19 vaccines for children ages 5 through 11, and resources for talking to parents and children about vaccinations. This will be followed by a moderated Q&A. Our speaker today is Dr. Paulo Pina, who is a board-certified pediatrician and the Network Pediatric Medical Director of the Family Health Centers at NYU Langone. He's an assistant professor of pediatrics at NYU Grossman School of Medicine, and he received his medical degree from NYU School of Medicine and completed pediatric training in chief residency at NYU Bellevue Medical Center. Subsequently, he received a Master of Public Health degree from SUNY Downstate. And Dr. Pina has been a practicing pediatrician for almost 20 years. Our Q&A moderator today is Linda Thompson. She's a community health worker with the Department of Population Health at NYU School of Medicine and the Institute for Excellence in Health Equity. She brings with her experience as a hotel executive responsible for managing several departments and revenue management. She has hired and trained thousands of people in her career. In addition, Linda is the health ministry leader in a large New York City church. Her work as a health and wellness advocate has benefited the New York City community for more than 2 decades. This past June, Linda received a visit from the First Lady, Dr. Jill Biden, and Dr. Anthony Fauci to see the work being done at the vaccine center she created in Harlem. Linda continues to get thousands of New Yorkers vaccinated and tested so that we can have a healthier world to live in. And with that, Dr. Pina, the floor is yours.
All right, thank you. Just give me one moment to share my screen. Okay. Okay. Good afternoon, everyone, and it's really a pleasure to speak with you today. It's something that I'm very passionate about as a pediatrician. We live and breathe vaccination, and we completely support its use, because really for me, over the past century, one of the biggest innovations in medication is the diseases that we have been able to prevent because of a vaccination. So today I will be speaking to you about the COVID-19 vaccination in children and adolescents. I'll spend the first half of our time just giving you some information on the vaccination and the state of where we're at, and then afterwards we'll answer any questions. As we begin, I have no disclosures, financial disclosures. So the objectives really for this, briefly want to review the COVID-19 pandemic as it relates to children over the past couple of years, and then also we'll dive a little bit more into the vaccinations. We'll briefly address hesitancy, and at the end we'll answer any of your questions. All right, so we're going to start out with State of COVID cases in children and adolescents. So as of last week, over 7 million kids, children and adolescents have been diagnosed with COVID infections. And this is laboratory confirmed COVID infections. We've had over 22,000 hospitalizations. And unfortunately, a little over 600 children and adolescents have died from COVID. And for me, that is 645 too many because this is a preventable illness. In the next graph, you'll see that where a lot of the distributions of the infections are, as you can see, most of the California, Florida have had a lot. In the middle of it, you'll see New York City as well. And also just to remind you, these are just reported, confirmed infections with children that were tested. I'm sure there's probably a lot more that didn't come to see us to get tested, but these are the only ones that are confirmed. So, well, let's bring it more locally into New York City. And as you can see, again, this is as of last week, the cases are starting to go up. And I'm gonna just, all of these lines represent different age groups. And as you can see, really at the top of this is 5 to 12-year-olds are currently one of the age groups that has the highest rate of infections. More updated data from this week, the 25 to 34-year-old age group, which is just below, is catching up as well. So, but there's a tremendous uptake, that, especially in the last couple of weeks in New York City. All right, so now we know that children are affected, and they're affected at an increasingly higher rate over the past few months. Nationally, cases in children have gone up dramatically, some places up to 50%. So children are affected by COVID, and as you can see, there are some that have died as well. So luckily, over the past year, we've been able to get the COVID vaccinations approved for use in adolescents first, and now younger school-age children. So the next few slides, I'll just quickly go over the different types of vaccinations, how effective they are in children, and which ones we are currently using. So one of the ones that have been approved for use in the United States. So there's 3 currently: the Johnson & Johnson one, the Moderna, and obviously Pfizer. So the first 2 currently, and I'll be speaking mostly about the Pfizer vaccine because that's the one that's predominantly used in pediatrics. The Johnson & Johnson one and the Moderna are 18 and above, currently approved. So Johnson & Johnson vaccine, it's traditionally, the technology for it is where we've been used mostly in the past. It's approved for ages 18 and above. The efficacy in the studies originally in this age group, 18 and above, about 66% effective. They are doing studies in the teenage group, but as you know, one of the major effects and concerns that people have is the risk of blood clots with this vaccination. And as of yesterday, actually, the advisory committee of the CDC on vaccination actually stated that the preferred vaccinations should be either the Moderna or the Pfizer because of that risk. But currently, it's not available for use in pediatrics as well. So the Moderna vaccine is one of the newer ones with the mRNA technology. Again, it's approved currently for 18 and up. It's very effective in the initial studies, over 94% effective. There is data on adolescents that it's up to 100% effective in 12 to 17 year age group, but it's currently in with the CDC and FDA waiting authorization to use in this age group. But as we know right now, it's pretty effective, and there are ongoing studies and in ages 6 months and up, and we will probably early 2022 will have the results of those as well. But the majority what information I'll provide you in the next few slides is about the Pfizer vaccination. Again, mRNA, it's approved now, emergency authorization for ages 5 and up. So in the initial studies, 95% effective in those 16 and above. For the age groups 12 to 15, it's about 100% effective in preventing COVID. And recently, we received data and approval for use in age 5 to 11, and the study showed it's about around 91% effective. And one of the interesting things about it is that this is a third of the dose. So this age group, there's less of actual mRNA as the adult formulation. And again, there are studies going on currently for ages less than 5, and hopefully early next year, we will have some results. So some of the adverse effects that that we see from these studies, and currently when we're giving the vaccinations, we speak to our families about. So common ones are just basically pain and swelling at the injection site, and that's really some of the most common ones. You can get fever, headache, tired muscle aches and chills. Interestingly enough, we're seeing less of these side effects with the 5 to 11 year age group. I think mainly because it's less of a dose. Now, early on, there were some concerns as we were getting reports of more serious side effects. And one people originally think about is had getting an allergic reaction. And that's why we usually have people wait after they get vaccinations before we go on. And then there's also myocarditis, which I will speak a little bit more about and give you more information about that as well. Okay, so let's first talk about the myocarditis, which is just inflammation of the heart. Just to let you know, in the studies for the 5 to 11 age group, there was about 3,000 children in that study. There were no reported cases of myocarditis in that age group. Now, as we start giving it to this age group in the general population, we will be monitoring to see if there are cases. But in the original study, there were no cases reported. Now, most of the cases that we have had after vaccination have occurred in the older age group and mostly in young adult males. Most of the cases were ages 16 and to the 16 to 30. And most often it came after the second dose and usually within 4 days. The great thing about it is that all these cases were mild and everybody recovered. But as of October, the CDC reported there was about almost 2,500 cases reported, and this is in all age groups. It's not just the adolescent, or in over 300 million doses given, but everybody in those cases have recovered. An important thing to point out is if you get the COVID infection, you're more likely to get myocarditis from actual the infection than the vaccine. And so that's an important point to make to our families as well. So actual the COVID is a bigger risk for this than actual the vaccine. Okay. So what is the current state of vaccination, where we at with children and adolescents? So For the 12 to 17 age group, so we've been giving this vaccine to them since the summer. We've had about 15 million adolescents in age group get vaccinated, which is represents about 61% of the total population. And then those who have completed the vaccination, it's about 13 million. Now, last month, we just started giving it to the 5 to 11 age group, and about almost 5 million children that age group have gotten the first dose, and that's about 20% of the nationwide population. I'll give you specific data about New York in a second. If you could just look across the country, this is the slide obtained from the American Academy of Pediatrics. As you can see, from the 12 to age group, in the Northeast, we're sort of doing really well in terms of vaccinating this age group. But as you can see, some places have a lower vaccination rate. I think Wyoming's the lowest at 37%, and the highest would be in Massachusetts. And in New York, we're about 74%. So far for the 5 to 11 year age group, again, we've only been doing this for about a month. New York's about 20%, and I think the highest we have is in Vermont at 47%. So they've been gung-ho getting it, making sure all the children are vaccinated. So let's look at how we're doing in New York City. And this is data as of last week from the New York Department of Health. As you can see, the adolescent age group, about 82% have gotten their first dose. And those that are fully vaccinated is about 72%. We just started again giving it to the 5 to 11 age group, and 31% already have gotten it, which is really great. And already about 19% have gotten the second doses already as well, which is really great. If you look, there hasn't been much sort of disparity in terms of gender. It looks pretty, but we do have, again, as we've seen with a lot of COVID, especially with the deaths, a disparity in terms of ethnicity and race. It's amazing our Asian Native population has really given a lot of to their children, but we still have a ways to go, especially with the Black population and even white as well in New York City. So we do have a lot of work to do to speak to our families about getting vaccinated. All right, so quickly, I'm gonna address vaccine hesitancy, because I think it's really important, because at any one point our families will come into our office. They might be not completely just, yes, I'm going to get it, but they might have some questions. And so it's really, really important to address any concerns that they might have. So I'm just going to give you recent data on a study of over 1,500 parents to look at, and they've been asked at different points throughout the year. But the last one is that you can see in October, and it's usually what we see with most vaccinations. There's about a third that, yes, just give it, we believe in it. There's the third that will say about, you can see here about 30%, definitely not, we are not getting this. And then there's the in-between, that they're not sure, they're trying to wait and see. And this is really, and because they're not completely against vaccination, and really we try to focus on this age group and use skills to try to get them to that, yes, I'm gonna get it right away column. And so in this same study, these were the top main concerns that parents had. One is that we don't have don't know enough about the long-term effect of the vaccine. They're worried about the side effects. Also, one of the top concerns we hear a lot is about it's going to affect their fertility or even puberty. And one of the real concerns is that, you know, parents having to take time off, not only to get the kid vaccinated, but if they do get side effects that they need to miss school, they might have to take more time off. So these are all things that we have to discuss with the parent and come up with a solution that could work for them as well. And one of the important things is parents want to be able to get the vaccine at a place they trust. And as you can see through, especially dealing with vaccine hesitancy, having that trust, developing that trust with your families is very key in getting them to agree to get vaccinated. Okay, so how do we address some of these vaccination hesitancy? Well, one of the most important things is to realize that this is a personal decision with the person in front of you, the family in front of you, and really trying to personalize it and really develop a trust with that family is important. Listen to their concerns and acknowledge them, because some of their concerns might be real, and really try to address what is the one thing they're really worried about it that's keeping them from getting their child vaccinated, and try to address it that way. Most of y'all have been trained in motivational interviewing skill. I think it's one of the most amazing tools that we have to get people to change behavior. It's all about being empathetic to their concerns, listening to their concerns, and really trying to move them along to change the behavior that you want. In the next few slides, I'm gonna just present some of the common questions that I get, and hopefully they'll help you answer as well for your the families that you interact and work with. So let's talk about the if there's any contraindications to getting it. If you have a severe allergic reaction, and we're talking about anaphylaxis after the first dose, so that is a contraindication. So also, if you have an allergic reaction to some of the vaccine components, which is rare because there's really not that much in terms, especially with the Pfizer, there's the mRNA, there's some fats, there's some sugars and salts. And so, it's really rare to have allergies to these things, but not impossible. But if you do have a history of allergies, we usually monitor those people's, and it's not, even if you have allergies, and a lot of our children do, they can still get the vaccination. It's just we have to observe them, because that reaction usually happens within the first 15 to 30 minutes. And so we observe them, and if they do okay during that time period, is usually they're going to be fine for that. So a lot of other questions, especially with a lot of mothers might be pregnant or even nursing, and they're wondering if they can still get the vaccine. And we definitely recommend that pregnant individuals, and also those that are lactating, get the vaccination. So it really, and there's studies now that show that even the mothers can pass the antibodies to their infant because they can't get vaccinated at this time, but they can surely get COVID. And we've had a lot of infants with COVID as well. So it's really, really important to encourage pregnant and lactating individuals to actually get the vaccines as well. And one thing I'm going to plug, we do have our vaccine center conducting a major study on understanding the vaccination in pregnant and postpartum women. So you will send this link later, just in case if you have any families that might be interested in participating. All right, so another question, the fertility question is coming up a lot because I think especially in social media, that's a big topic floating around. So it does not affect your fertility, or does it affect puberty? And there hasn't been any evidence or even a biologic basis on how we would do that. And I can just show you that, reassure you that no vaccine has ever done that. And we don't, and this doesn't as well. So, but it's still, this is still going around, but as more people know the actual information about it, I think that'll help sort of like bring this myth around, but it does not affect fertility or puberty. All right. Big question I get a lot is, so most of the time they get a mild infection, why should I get the vaccine? So for me, there's a lot of ways you can answer this, but first of all, the numbers, especially in children, is rising. And just because of, the majority of the children will have a mild illness, there are a lot, especially those with chronic diseases like asthma, even obesity, that don't fare as well. And we've had a lot of children die and a lot of children hospitalized with it. So the best thing to do is to prevent the infection. The other important thing, as you can see what's going on now, especially in New York, a lot of our younger people are getting it. And the more disease that there is out there, the more likely it is for it to spread. And when you have a lot of illness out there, we're going to have more variants, and eventually, we are worried that at some point the vaccines might not be, if we develop a serious variant. And this is just going to prolong the pandemic. And we really, really want to sort of end this. And the children going back to school, we're seeing a lot of mental health issues. We're seeing a lot of complications from the fact that children are not in school as often, and they're more isolated as than before. And another important thing, it really is, if the whole family is vaccinated, you're protecting your whole family. I think that that's an important thing. And then also your community. So, and in the school settings, we're seeing a lot of cases in schools as well, is to protect everybody around you as well. All right. So the last couple of slides, I just really want to emphasize the resource where you can get vaccinated. So NewYorkCity.gov Vaccine Finder is a great resource. You can also check with your provider, all the major pharmacies, see if they're offering it. You can also call Vax for New York City to give they give you sites as well. And just remember, New York City is offering incentives for of $100 for the vaccination. And they also have an in-home vaccination program as well that you can access through these sites. Again, the New York City Vaccine Finder, you just plug in your information, zip code, and you'll be able to see closest place and whether they offer the incentive, which vaccine they offer. And obviously for children, it's going to be the Pfizer vaccination. Things to keep in mind that especially for the younger, parental consent is required. For the younger age group, up to age 15, they actually have to accompany it. The older teenagers don't necessarily have to, but they should get consent. This last slide I'm presenting is really to just highlight the importance of getting vaccinated. So the cases are going up again in New York City. And as you can see, they're tracking what, the percentages of vaccinated. So it's really driven by the unvaccinated cohort. So again, this just emphasized the importance and the need to get vaccinated. And if we vaccinate the children, it's really going to help decrease the spread as well. So in summary, the vaccine is safe and very effective in children and adolescents. Like I said before, the numbers are rising. We're really concerned about that. And really develop a trust and use motivational interviewing skills to talk to your families and hopefully lead them towards getting vaccinated. So I think that is it. And we can go to questions.
Thank you so much, Dr. Pina. Thank you so much. We appreciate you greatly for taking your time out to give us this wonderful education and this fantastic set of information that we can share with our family and friends. We have so many people with us from not only New York City, but all over the country. So I just want to say hello to folks in Chicago and to Albany and Delaware and also Nigeria. Thank you so much for joining us. So Dr. Pena, we do have a lot of information, a lot of questions that I would like to ask you from the group. The first one is, how do we engage parents who don't want to vaccinate their children? How do we engage them?
Yeah, so I think the key point is to engage because a lot of times we sort of write off people and just be like, well, I can't help you, so go somewhere else. Mm-hmm. That should not happen. The goal is to develop a relationship, acknowledge their concerns, and address it every time. I have, families that refuse to get all vaccines, but there's a lot of other things that, because I'm there to help their children develop and grow. And vaccination is just one aspect of it. So I think we need to be there for the family to address every concern. And then every time I talk to them about vaccination and then hear what they have to say. What is it really that you are worried about? And then I ask their permission, can I share information with you? Mm-hmm. But really it's a shared decision making. It's not just me telling you to do this. It's about us working together to get you to what I believe is important for your child to be healthy.
Wonderful, thank you. The next one is, many parents have been fine getting regular vaccines for their children, but are worried about the COVID vaccine because it's so new.
Yeah.
What do we say to those parents?
Yeah, so it is. It's new, but that's the nature where we're at. We are in a pandemic, and everything happened. It happened fast, but nothing was shortchanged. Okay, so the technology for the mRNA technology has been studied for over a decade. Okay, it was just applied to the vaccination because we were in the middle of a pandemic, and we realized that we could do that with the mRNA technology, and also just realized there's like thousands of really smart scientists around the world working on this. And there was a lot of money placed on it. So governments were giving money. So there was resources to do this in a quicker pace, but nothing was shortchanged. All of the processes in terms of determining safety, efficacy, all of those stages that happened with other research happened here. It's just there was more resources, more people available to do it quicker.
Okay, wonderful, thank you. The next is the Omicron variant more dangerous for infants and children than previous COVID variants? And how do we keep the young people safe from these?
So we're still learning a little bit by more, but I can tell you what we know so far. So we know that, and this is data coming from mostly Israel and South Africa, and some of United Kingdom as well, that you do transmit it more easily and more than Delta. But they're also seeing that it might be milder in terms of severity of disease. So far, for adults, we don't have much information on children. For adults, you getting the booster, which is a great point right now, that we should all be getting boosters, especially in New York City. That if you get the booster, it helps in terms of preventing, and also keeping you out of the hospital and dying as well. 2 doses, if you've gotten 2 doses of the vaccine, it doesn't look like it works as well. But if you get the booster, yes. In children, so far that we know that it is, like I said, milder, but we don't have information about the vaccination, whether it protects or not. But definitely, you know, my viewpoint is probably will, but we don't have the information yet.
Okay, wonderful. And how do we keep children safe who are too young to get vaccinated?
Yeah, so that's important. So anybody in the household that can get vaccinated, because that's to protecting that child. But it's just really being careful of places you go to, crowded settings. Obviously, children less than 2, we don't recommend that they wear masks. So it's really everybody else around you taking precautions, washing hands, you know, wearing masks for the older, and then whoever can get vaccinated, get vaccinated.
Thank you. And what are some of the most prominent signs of adverse reactions to children so far?
So serious or the most common ones, it's really just arm pain. And in the 5 to 11 age groups, and I've been talking to a lot of our families when they come in that have gotten it, most of them are saying, oh, they were fine. They were fine. They were running around afterwards. There was nothing. So the majority, it's really the arm pain and the local side effects. We haven't, and I can say a significant amount of my patients in this age group have gotten vaccinated, non-serious adverse effects yet.
Okay, wonderful. Someone here says, I have read the position of the American College of Rheumatology and want to know your thoughts on how children with autoimmune disorders should.
I'm sorry, you cut off. I did not hear that last part.
Oh, one of our members says, I have read the position of the American College of Rheumatology and want to know your thoughts on how children with autoimmune disorders should proceed.
So obviously you should definitely consult your pediatrician and also the rheumatologist. But in my viewpoint, especially because they are immunocompromised, that they should get that. That's the recommendation that we have, that they should get vaccinated. I cannot tell you, because there's just not enough data of like how many vaccinations, because being immunocompromised, you do worry that they might not respond as well to the vaccination. So I can't tell you how many because the data is not there yet. But I definitely believe doing the 2 doses, they should definitely do it.
Okay, is there anything known about immunity in infants already or antibodies being passed via breast?
Yeah, so definitely, well, part of the studies we're trying to figure out in breast milk or breast milk, we know it's in breast milk, which is a good thing, but during the gestation, it does get passed on. So if your parent has been vaccinated, either before or during pregnancy, it does pass on to the infant. Unfortunately, as with all of those, it doesn't last for a long time. We're still trying to figure out when does it go down, but normally, usually around 4 to 6 months, those start to come down, but there is at least protection in the first few months, which is critical because they can get really sick.
Okay, how do you respond to a person that believes more in what the media has to say than what professionals such as the CDC and yourself have to say?
Yeah. So I don't argue. I don't challenge. I try to ask, you know, what about what they're saying makes it more believable. So I get to what is going on instead of, you're wrong but as you go on, you develop that relationships. I have families coming to me and be like, what do you think? Should I get it or not? And then we have that discussion. So, but that's because we've developed relationships and there's a level of trust that's developed. So I don't really get animated or upset when parents challenge like that. Actually welcome it because they should. This is their child. I'm there to help. And so definitely if they have questions, I just get to the reasons why.
Okay, if a child has asthma or diabetes, is there any harm? Because a lot of parents have questions about that.
No. And they were included in the study. And then also I can give you from personal experience with my patients. I have a lot of asthmatics and diabetics. They've all been getting it because recommended, especially because they are considered a sort of a higher risk group of getting seriously ill. And so those, especially with those conditions, definitely should.
Do you know at this time if children will have to continue to get vaccines as well as adults as the years and time goes by?
Yeah, so right now the boosters recommended 18 and above. There were discussions of changing that to 16 and above, but as of right now, it's still 18 and above. And then the other younger age groups, we're not going to know because we just started vaccinating them. But we'll probably early next year know if we have to boost children as well.
Does a lack of aspiration during vaccine administration lead to an increase in reactions? I have a mixed professional opinion about this question, someone says.
Okay, I'm trying to understand the question. Does giving medication?
Does a lack of aspiration during vaccine administration? Does that make sense to you?
Lack of aspiration? Yeah, I don't.
Okay. Let's go on. Let's go on then to the next question. Let's see. What do you know? What can you tell us about the allergic reactions with children that have reactions that have had reactions to the flu vaccine?
Yeah. So most of the components are different. So even if you have a history of allergies, that doesn't mean you shouldn't get vaccinated. So what we do with those kids is we just observe them for a longer period of time, about 30 minutes. And if there's no reaction, there's not going to be one.
Can you help us as far as the new Omicron variant goes? Yeah. Will our vaccines protect us against that?
Yeah, so like I said before, the studies from Israel showed that if you get a booster, yes. And but the 2 doses won't keep you from getting it. You can still get it, but it'll keep you from hospitalization and that. But to be really more protected, a booster dose is what's recommended.
Okay, there's a question here that says, do you have any information as to the cases in Mississippi for the number of children who have been vaccinated?
I think I can pull up I'll share again And we'll look at Mississippi. I didn't look at it before, but I have I'll pull up the slide that shows by state. Give me 1 second. Oops, sorry. Okay. So okay, so we're about yeah, 41%, which is okay. And then the other age group right now it's about 5%. So it's a little bit lower for the 5 to 11 age group. And then we still got a lot of work to do with the teenagers as well.
Okay, great. It appears as though I am. Can you hear me, doctor?
Yeah, I can hear you now.
All right, wonderful. When will kids under the age of 5 have access to the COVID-19 vaccines?
Yeah, so the studies are ongoing. So we are anticipating first quarter next year to get the data, but probably approval might be a little afterwards. But this age group is probably taking the longest because you needed enough participation and also enough of them getting exposed to it. This is an age group that's completely protected. And so we just need a longer period of time to actually get the results, but we're anticipating early next year.
Okay, I have a question that says, what about the booster? What type of booster should I get? What are your recommendations?
Yeah, so just from information from yesterday, the preferred vaccines now, it seems like it's the Moderna or the Pfizer. And if you've gotten, I usually just stick to what you've gotten if you're going to do that, but you can switch the Pfizer and Moderna for the booster. And if you've gotten the Johnson & Johnson, it's usually for older and above 18, my recommendation would be to get a booster with either the Moderna or the Pfizer.
Wonderful, wonderful. How can we as a community debunk some of the myths that are circling around about social media and social media outlets?
Yeah, it's a fight, it's a challenge, as with everything. It's not just vaccination. We just have to, do this, do other things, and then we just have to have other voices speaking up as well and providing information as well. But it is a challenge. I think there has to be a comprehensive approach, like government, involved, and there's some responsibility for these social media companies to actually monitor what is being said. So, but it's really hard when you live in a free society to just say, no, you can't say that. We just have to be able to be there to provide a counterpoint and provide information to people. And so doing this event, doing multiple events like this, putting information online really, really helps.
Thank you, Dr.
And word of mouth, word of mouth.
Word of mouth is very important. That's why we have these types of forums, so that we can have our pen and pencil together, write the information down that someone as wonderful as you are is giving to us, and we can pass it on to our friends, our family, and our clients. It's wonderful. This is why this is necessary. Can you speak about the following concerns? The point that the risk of developing myocarditis is over the kid's lifespan from the vaccine. So I guess that would be long-term effects.
Yeah, so I didn't talk about long-term effects. So the majority, all the vaccines, like historically that we had, most of any effects that you see is when then the first 2 months. That's when we see the effects. So when people talk about long-term effects, I just let them know that historically, no other vaccine has done that after that period of time. So any effect that they're going to have, you're going to see it within the first couple of months. And I think we've had enough data so far over the past year and a half, given this vaccine, that we know that. We know that. After that immediate period, we don't see anything like that.
Okay. Do you recommend having some space in between amount of time between the flu shot for a child and for a child getting their vaccine?
Yeah, so you can give the vaccine together with any of the other vaccines that we have. And so if parents ask, I'm like, it's okay, you can give it. But I do understand their concern. And so if they want to space it out, I usually tell them, you could a week later, 2 weeks later, that's fine. But don't prolong it because both right now are very important.
Okay, wonderful. There's someone that states here that in NYU Langone, in the ER, there are more patients having COVID than I have heard. What have you heard?
The cases are going up across the city. I don't know if you haven't seen the lines at testing centers. So if you look at the graph right now, it's instead of like going like this, it goes up last week and this week is straight up. So we've doubled the number of cases in 3 days. So that's it's really concerning right now what's going on.
Okay, and what are some of the signs? You may have addressed this slightly, but what are some of the signs as far as adverse reactions that parents should look for in their children?
Yeah, so there's ones that you're gonna expect, the arm pain. And if it's really bad and they're not doing anything, give them a little Tylenol or Motrin, and that'll help. Or even a warm compress. If they get a fever, treat that. But these are all the things that you expect. Now, for the myocarditis, I speak to the parents, things to watch out for is if they complain of chest pain, or they feel like their heart's beating really fast and they're short of breath. Those are the main things. Any of that, please seek medical care. But like I said, most of those cases are mild and usually they get sent home the same day and just told to just watch it. But those are the main things to watch out for in terms of the serious side effect. And in terms of the allergic reaction, we observe them after the first dose for 15 to 30 minutes anyway. So you're gonna know before they.
So should parents be on the lookout if their child gets normal reactions to other types of things in their lives?
Yeah, so it's like we usually tell, because obviously most of them are used to vaccination with the other vaccines. It'll be like the rest of them. They get arm pain, they might get a little temperature, and let us know if anything's serious or like the chest pain or anything like that. Yeah.
Mm-hmm. There's been some talk that after you get your vaccination that you should drink more water that day. Is that something that you would recommend?
Well, you should always do that, stay hydrated. So I believe in that. Just stay hydrated. Just stay hydrated because, especially because some of the effects that you can get is headaches and things like that. So proper hydration and rest helps with that. So yeah.
Okay, wonderful. And some parents are saying that for themselves, they may take a Tylenol right after they get their vaccine. Do you recommend anything like that for children?
No, only if they're bothered, if they're in pain or they get a fever, because you want to make them comfortable so they can rest. And I'm okay 1 to 2 doses, that's fine. As long as you're not giving it around the clock.
Right.
But 1 or 2 doses, that's fine. That's fine.
Okay, and someone here says that there's an article today that Pfizer failed in ages 2 to 5 because the dose
in the New York Times. I didn't want to talk about because so there's preliminary. So we haven't seen the data, but it doesn't look promising so far. But we'll see what Moderna has to say.
Okay, Doctor, we've gone through a lot of questions and a
Yeah.
lot of answers, and you've given us
These
some
are great
fantastic,
Yeah.
yes, and you've given us some great answers. We really do appreciate it. What else should we take away from having a conversation with parents about getting their child vaccinated?
Yeah, I think it's really important just to first just ask them, how are they doing through all of this?
Mhm.
And just making sure that they are okay, because, you know, we have the COVID, but then we have everything else that comes along with it. The lack of socialization, the lack of seeing your family, the lack of hugging and touching. And that has really affected our children and adolescents. The amount of behavioral health, emotional issues that we are seeing, we've never seen before. It's actually a crisis right now. So see how everybody's doing, and then see what's important to them. What is their goals for the family? What is it that they really are trying to accomplish throughout this whole thing? Is it, you know, nobody get COVID, or just live their lives, and then go from there? But really ask the families, how are they doing and what's going on? I think that's a great conversation starter. And then that will lead into, well, what about vaccination? That can help you, you know? So, but really figure out what's going on with their families.
Wonderful. Thank you so much, Doctor. It has truly been an honor and a pleasure to spend some time with you. And I know our viewers have been totally enlightened by the information that you've given us.
Yeah. Well, it's been a pleasure. Really, really, any chance I get to talk about vaccinations, I do.
And I also just want to thank you both so much for your time and expertise, both of you. Dr. Pina, pediatrician and pediatric medical director of the Family Health Centers at NYU Langone, and Linda Thompson, community health worker at in the Department of Population Health at NYU School of Medicine. So please take a second to answer the poll that just popped up on your screen. There's 4 questions there. If you scroll down, let us know what you thought of today's session. If you want to send us some feedback of what other kinds of topics you'd like us to cover, you can send those to Dina, who you got all the information about this webinar about. But yeah, I really enjoyed today's session a lot. I learned a lot, and I really appreciate you you sharing your time and expertise with us, Dr. Pina. And
Sure.
thank you everybody for joining us. Thank you to all of our partners you'll see here on the screen, who helped us put this event together today and help us with all of our webinars. So yeah, I hope you'll join us for whatever our next topics will be next year. Stay tuned. You know, do reach out via email if there's anything we didn't cover today that you'd like us to cover in the future. And a special shout out, as always, to Dina Pimenova, the project coordinator of the Community Health Worker Research and Resource Center, for making all this happen, and to Sarah Hussein for helping us as well. Thank you, everybody. Have a wonderful rest of your day and weekend. And happy
Thanks, Ms.
holidays.
Thompson. That was great. Thank you.
Thank you.